Sekta ya Uiiti nivatonyeka ikatambaika na kwonza kyumwani kyukite kumanwa na uito wa mikomo ya athukumi sektani itina wa kyama cha kuukitia mavata maovisa ma Uiiti Ilinikini Kenya Union of Clinical Officers kutangaasa methiwa mayambiisya Mukomo wakwambiliilya ukite mukomo wa Clinical Officers wiuka ivindani mukomo wa matakitali walika muthenya we 12 kwi muthenyani wa umuthi mwaka.
Uiiti withwa uitambaika vyu masivitali ni kwambia chuma kichukite ethwa serikali Disemba na mituki kusia mukomo ungi savali no Maovisaa ma Uiiti ilinikini yani clinical officers alakwi umuthi manenga serikali notice ya mukomo wo.
When we did our petition on 4th of this month and gave them 14 days, this Monday, that is last Monday on 18th, when the 14 days elapsed, we came out and we actually gave a public address and we added them another 7 days to resolve the things within the petition. It's unfortunate that there is nothing that we raised in the petition has been addressed in the last 14 days. And therefore, last week we engaged our members across the country, and last evening the National Advisory Council of the Union made a decision that we are calling for a strike and that we have to issue a 7-day strike. The strike to commence on Monday, that is after the midnight of Sunday.
Kuyanana na ngwatanio ya Kuco ni kana vayingwa wiweno ona umwe mekianie sai na muvya Uiiti mwini wa monza mwaka muvitu ula waisa kuyaniwa na meweta mathina mo maumite nthino wa kuselwa kwa misala kuvetangwa wiani kulea kwamba twendeve ondumwa na kulea kuandikwa kwa Maovisaa ma Iliniki ma maovundisyo yani interns katwa maunungu nisyo ange.
The perennial issues affecting services delivery by clinical officers, including delayed salary payment, lack of promotion and redesignation, dire shortage of over 70,000 clinical officers, discriminatory and exploitative terms of short-term contracts, and a failure to implement approved staff establishment for interns, among others, persist unabated.
Mukomo wa clinical officers nono watangaswa ni ngwatanio yo ya Kuco wiuka ivindani thi mukomo wa madaktari naguo walika muthenya wa 12 kwi umuthi ngwatanio isieli KMPDO na Kuco sieteta kinandu imbya cha Uiiti cha shift nikiuvathula athukumi mo kuisyani wondu kuna ile ivindani ya NHIF.
The clinical officer offers services that they cannot afford, yet we pay government money that is actually supposed to procure services for us. Last week, we received a number of calls where our members are not able to access services because NHF, by any manner, is not now functioning. And that is a critical thing.
Na yumu vya wa Uiiti vamwe na nzama magavana COG onthe meithwa masyaiwe kwa vakuvi kumana undu meithwa maithinikia mikomo ili no kana kutangia sekta ya Uiiti masivitali ni.
The most unfortunate thing about this is that we have given the government enough time. We have tried diplomacy. We have followed the law. We have gone to the Ministry of Labor. We did conciliation. It failed because the government was not committed.
And furthermore, we issued a strike notice last year, July, which they call us on the table, the Ministry of Health. We signed a document which we do have on 13th July, which we provided that we are going to resolve this issue of the CBA within 90 days. For the government, 90 days has never ended. They're still counting 90 days.
Solidarity forever.
Vilengwa mauvoku mavamusini wa Ilovi nye nita wa Benjamin mwaka.